Apparently, the shock of an ICD feels like you've been kicked in the chest by a horse. Hi everyone, welcome to part 4 of my journey from heart failure to heart transplant. In this video, I'll share my experience of getting a transvenous ICD fitted. I had this device fitted about a month after my hospital admission in Leeds, where they found out my heart was working at 10 to 15% ejection fraction. But I had had conversations with my cardiologist on and off about getting an ICD for many years. I think since I was 17 years old. But essentially, an ICD is a defibrillator that is implanted inside your body. It constantly monitors your heart's rhythm, and if at any point it detects a dangerous or abnormal rhythm, it will deliver shocks to basically prevent you from going into cardiac arrest and therefore preventing sudden cardiac death. So I was fully prepared to have my ICD fitted and deal with the consequence of potentially receiving shocks. I knew how important it was, especially having that terrifying acute heart failure episode just a month previously. But when I arrived at the cardiac suite, every interaction that I was having with the nurses, the staff, the doctors, everyone, it just made me more and more stressed and nervous, to the point where I had a bit of an emotional breakdown in the theatre room when I was lying on the table, and tears just flooded my cheeks. Basically, what I'm trying to say is that it really doesn't matter how mentally prepared you think you are for a procedure or operation. Ultimately, your natural stress response will be triggered, but the healthcare staff and the people looking after you on the big day play a huge role in reducing that stress response, so that you don't have an absolute breakdown like me before they've done their knife to skinny shenanigans. So yeah, with that, let's get into this video. When my parents and I entered the cardiac suite, I went up to the receptionist and my God, she was so lovely. I mean, I've never met such an enthusiastic and friendly person in my entire life. I go to her all jolly and tell her, "Hi, I'm here for my ICD procedure." Mentally, I'm in a good mood. I'm upbeat. I'm obviously going to go up to her with a smile on my face. And she's like, "Oh, you're at the wrong reception. You're supposed to sign in at that reception." Like I said, really friendly. Mind you, the reception that I'm supposed to sign in at is only like 10 steps away. Point is, it made a difference to my emotional state. I've been a receptionist too, alright? And I've learned what makes a good receptionist. And the first step is treating every single patient as if they are the first patient to walk in. Greet them with a smile. Be nice. Bring a little bit of positive energy, because you don't know their situation. You're not going to be the one in the theatre room in a couple of hours having their little procedure done and a wire into your heart, okay? Ultimately, that patient is going to bring your negative energy into the next room with them. And that's kind of what happened. Then I signed up at the correct reception. My mum and dad were with me, okay? We weren't sure if both my mum and dad could come in and wait with me, but we thought we'd ask anyway. What's the harm? I was pretty sure that they'd allow at least one of my parents to come in and sit with me, but when this nurse signed me in, she said, "No, sorry, only the patient is allowed through. That's the rules." Now, I'm not gonna lie, I wouldn't have minded if I knew my procedure was going to be soon. But the nurse couldn't tell us when I was going to go in for my ICD procedure. She told us it could be 30 minutes, it could also be 2 to 3 to 4 hours. That's a really long time. So it would have been nice and more comforting to have one of my parents with me during that time to take my mind off the procedure. A different nurse, a more senior nurse, comes along and she clearly sees that there's a bit of a hold up. And she asks the other nurse, what seems to be the problem. She explains my situation, saying that I'm requesting very nicely to have one of my parents wait with me. And immediately, this senior nurse, absolute angel, she doesn't even hesitate. She lets me and my dad come through, no problem at all. And I'm here thinking, well, that was easy. I wish we spoke to her right at the very start. Because the first nurse was just stressing me out and just not being very sympathetic to my situation. Point is, you can't treat every patient like a textbook case. Because the reality is that not many people have an ICD procedure in their 20s. Even 30s and 40s, not that common. So you've got to understand, you've got to be a bit sympathetic. If I'm asking really, really nicely for one of my parents to stay and wait with me, I'm not trying to be a difficult patient and make your life hard. I'm genuinely asking because I know it's going to calm me down and make me feel more comforted, which is all going to help me when I go into the theatre room. Anyway. After a couple of minutes, the first nurse who signed me in and said only the patient can come through took me into a room to do like a health questionnaire, pre-ICD check. I basically went into this room with her, and as soon as I sat on the chair, I just got really emotional and I started to cry. And then she said, "Oh, why are you crying? What's the matter? Is it because you want your dad with you?" I can't do the Yorkshire accent. And I'm here crying like, no, it's because I've never had such a big procedure in my life. I was not at all worried about the ICD procedure. And now, all of a sudden, I'm worried. It was a tiny seed in my head, and now it had grown into this huge thorny bush. She gave me a tissue and I calmed down. In this questionnaire, she basically just went through my medications, when I last had something to eat and drink, because obviously you have to be nil by mouth for the ICD procedure, whether I was pregnant, diabetic. I swear she asked me if I was diabetic like 7 times. And that again got me frustrated, because at this point, my heart failure was really, really taking a toll on my energy levels. Like, if I've told you I'm not diabetic, don't ask me again. It's the same thing with pregnancy. I've told you already, there's no chance of me anyway. An hour or something later, basically, the anaesthetist came and went through the risks of the procedure. He was a lovely person, don't get me wrong, but it was just so scary being told all the risks, like, on the day. Like, I've read through the leaflet and stuff. I know there's a risk of lung collapse or punctured heart and all that jazz. I know, I get it, but it's just a bit scary being told again, like an hour before your procedure. It just makes it feel so real and a bit more stressful. I know they have to make sure you're aware of these things, informed consent and all, but it just kind of stressed me out a bit. About 2.5 hours of waiting, and it was finally time for me to go in for my ICD procedure. 2.5 hours. That's a long time. So imagine if I was waiting for 2.5 hours alone in a big room full of like older patients and just thinking about things in my head. So A different nurse comes in and she takes my height and weight, and then she hands me the hospital gown that I need to change into for the procedure. And mind you, she's not telling me how to wear this gown. Is it front to back? Is it back to front? I don't know. She didn't explain. I also asked her if I could keep my tights on because there was no metal at all, and I specifically wore clothes on that day that didn't have any metal on, just so that I could be a bit warmer and a bit more comfortable. And also maintain a bit of like modesty because I really don't like exposing my skin that much. But this nurse just wasn't very sympathetic. She wasn't really giving me a valid reason other than it's the rules. And no offense, but that's not good enough. Anyway, because this nurse didn't explain to me how to put the gown on, I just assumed that you wear it like you wear a normal coat. When I got out of the changing room, there was a different nurse who was supposed to take me down to the theatre room, and she was waiting for me outside. And she was, honestly, the only person to comfort me the most out of however many staff I encountered that day. She basically told me how to put it on. She gave me another gown to protect my backside because it's fully exposed, you know, it's fully exposed. She reassured me that no men would see anything. Again, very comforting, very reassuring. I'm so calm now. Then on the way to the theatre, she's cracking a joke, being lighthearted, making a funny comment about my grippy socks. You have to wear these grippy socks to prevent you tripping, and she's just so jolly and like nice. She's distracting me from the day of the doom and gloom and the, oh, you might have a lung puncture and put this gown on and you're not allowed your dad, and do you know what I mean? And we can't tell you when you're gonna have your ICD. Stress. She's just distracting me from all of that medical-y stuff. She was the only person who made me feel like a person and not a patient. So if you're listening, nurse, thank you. As I entered the theatre room with this lovely nurse, she goes, well, good luck for your procedure. I'm sure it will go absolutely fine, and I'll see you back when you're done. And then she left. But she left me in a good mood, a really positive, comforted, reassured mood, which nobody else could really do that day. So as I was stood in the corner of this huge room, when I say huge, I mean like huge. Think 2 classroom sizes joined together, that kind of huge. It was gigantic. I did not expect it to be that big. So as I'm stood in the corner, my eyes fixate on 2 main things. The table, the metal table where I'm going to be lying down and having a device put into my chest and wire into my heart. The table, and also directly above the table were these huge tubes that just covered the ceiling. They kind of looked like huge suctions or vacuums. The kind of vents you find in, you know, those like huge restaurant kitchens. They actually looked terrifying. And being a non-medic, being completely unfamiliar with this environment, my stress levels just skyrocketed by this point. I was now depending on the reassurance and comfort of the staff in this particular room to ease my nerves. Unfortunately, not a single person gave me that level of comfort that I was hoping for. So after 1 or 2 minutes of taking in the theatre room, a nurse or assistant came up to me and greeted me, but in all honesty, she just didn't seem very confident, and that again didn't provide me with much reassurance. So this nurse very quietly asked me to take my top gown off and lie on the bed, and as I'm taking my top gown off, I'm getting really stressed because there's so many people in this huge room. There were about 15 to 20 people in this room, all in blue, all wearing masks. And I was not expecting there to be so many people, because I'm here thinking in my head, if it's such a simple day case procedure, why are there so many people? There were more people in my ICD procedure room than there were for my heart transplant. And okay, if they're medical students, I want to know that they're medical students. I want to know their expertise. I want to know, like, are they skilled? If something bad happens, are they skilled to do whatever they need to do to help me, kind of thing. Patient anxiety. So I said to this nurse, who was sort of helping me to take the top gown off, I sort of said to her, can you just ask all the men to, like, look away, because I don't want to expose myself. And the few men that were there, very, very respectable, they heard me and immediately turned away and even walked to the other side of the room, the huge room. So that was nice that, you know, at least I felt like a little bit of my dignity was respected. But then, when I lied on the table, I tried to keep my tears in as much as possible, but it got too much. It just all got too much, because I'm on this table and there's people doing stuff on both arms. One person trying to find like a vein to cannulate, one person adding my blood pressure cuff, another person adding my ECG stickers. There were literally 3 people doing stuff on me. It was just too much. Tears started coming down uncontrollably. My breathing started to get quicker and quicker. I started to hyperventilate. I started to panic. I just had a meltdown. So I'm here crying, right? I'm actually crying. I'm proper panicky right now. I can see my heart rate on the screen, 100 something. The doctor comes in and he's kind of just like stood around. He's not saying anything right now, but he can clearly see that I'm distressed. And all he says to me is, look, you need to try and calm down, because we can't continue until your heart rate comes down. Personally, I just don't think that was a very nice thing for him to say, because it's basically making me feel like I'm to blame. Like, he could have just asked me, why are you crying? And I would have just told him, I'm bloody stressed. And he should have just been able to see. Anyway, in that moment, I gave myself a little bit of a prep talk in my head, and I literally said to myself, Marine, if you don't calm down, you're not going to get this ICD procedure done, and you know how important it is for you to have this ICD in. So calm down, because right now you're being the difficult patient. In an instant, I just calmed down and I just said, okay, I'm sorry, I'm ready now. He was like, that's okay. Now you're allowed to have some sedation for this procedure. Would you like us to give you some? It's just going to make you a little bit drowsy, might make you a bit sleepy. It will just make you feel really relaxed for this procedure and calm your nerves down. Most people are probably going to be watching this thinking, yeah, she definitely took sedation. I mean, think about it. She was so stressed. She had a panic. She was nervous. She was crying, hyperventilating, really, really stressed. Of course she's going to take the sedation. Well, joke's on you, because I refused. I said no. And the reason I said no was basically, first of all, because I didn't want to put any drugs into my system that weren't necessary. And second of all, I don't want to feel drowsy. I wanted to be fully aware when they were doing the procedure so that I could remember everything. So I said no, but you might be surprised, but I was actually calm for the rest of the procedure. That prep talk that I gave myself in my head was sufficient enough, and it kept me calm the whole time. First step was to clean the area. They put this whole drape on top of you, and then I think they locate the vein that they need to go in by via ultrasound. Once they have found a vein, that's when they give you the local anaesthetic. That is the only time you're going to feel a teeny weeny sting, and that is it. You're not going to feel any more pain throughout the procedure. So then the site becomes numb and they just do their doctor stuff and you're just chilling with your head to that side and they do the rest. First thing they do is put the wire into your vein and then direct that lead into the heart. They find a suitable place in the heart to put the lead. Again, they know all that stuff. We're not going to go into any of that detail because I don't know anything. But once they found a suitable place in the heart, then they're going to check the ICD actually works. So they're going to, I guess they're going to turn it on first of all, probably. At this point, you're going to feel the heart fluttering a bit and you're going to feel like you're having palpitations. But the doctor actually does say at this point, you're going to feel this. So it's not like a shock to you. They always will tell you if you're going to feel something unusual. Just saying in advance, it feels really weird. It almost feels like there's somebody with a remote control and they're controlling your heart rhythm. That's what it feels like. Now that they know that the ICD works, they can go ahead and make a little pocket just underneath the collarbone, which is where the ICD is going to sit. I actually got to see the ICD before it was put in, so if you want to, just see the ICD before it goes in, do ask the doctor, oh hey, hi, hello, can I just see the ICD? And I'm sure they'll just show you. Because mine did, he just sort of showed me, and because my head was this side and he was like, do you want to see the ICD before it goes in? And I was like, yeah. And he just showed me and it's small. Now, this is the part that nobody's going to really tell you about. And this was something that I was sort of just told during my procedure. Basically, when you're young and you have an ICD or a pacemaker fitted, because your skin is so elastic, if you just pinch your skin, it just snaps back onto itself. This means your skin is very elastic. But as you get older, your skin loses its elasticity. So basically, you end up having a bit of a delay. You could grab your skin like that and it would sort of slowly go back. It won't just snap back onto itself. It will kind of just go. So you have more time to play around with, basically. So yeah, when the doctor was trying to make a pocket, he made the pocket, but then the skin just wanted to come back onto itself. So he had to remake the pocket. I just remember just sort of turning my head a bit and just seeing, what's the drama, what's going on. And his face was red. I could see from the corner of his eyes that he was like, which basically told me that whatever he's doing is taking a bit out of him. And I felt bad, but I was chilling. I couldn't feel anything because I had the local anaesthetic. And then midway, he's really trying to make a pocket and squeeze my ICD in. Are you sure you can't feel this? And I'm just there like, no, I can't feel anything. I just feel a bit of pushing and pulling, but no pain. He did even ask me after that, he was like, are you sure you don't want sedation? And I'm like, no, I'm calm. I don't feel anything, I'm fine. Anyway, after some time, and I think after a hard day's work, the ICD was put into me. And then the doctor's like making an announcement, you can all go now, I'm gonna just do the final touches and suture up basically. After they sutured me up, they put the dressing on and had my ICD in. In the next video, I will speak about my pre-assessment for a heart transplant at the Freeman Hospital in Newcastle. And that was where I was basically told that my heart was doing rubbish and that I would need a new heart, basically. Thank you for listening, and I hope this has helped.